Hello, my name is John Graeber. I've been a practicing dentist for nearly 40 years, and for about 20 of those years I have used lasers in my practice exclusively. Today we're going to demonstrate the use of the Odyssey Navigator laser by Ivoclar Vivadent. I have been using those lasers in my practice for approximately the last 6 years. Our patient, Bob, is going to be receiving a frenectomy of the lower anterior. He has had some periodontal difficulties because of the aberrant frenum, and we're going to relieve that frenum for him. Our patient has been anesthetized, and the reason for doing the procedure is that you can see that the frenum here has encroached upon the free gingival margin, causing recession and loss of attached gingiva here. So we're going to relieve the pull of this frenum by using the laser to remove and excise a certain portion of it. There are actually 2 muscle attachments present that we're going to revise. The first procedure will be to clamp the section that I want to excise of the frenum. We're going to initiate the laser tip by touching it to a piece of plain articulating paper. And when we use the clamp as a physical surgical guide for removal of this tissue. Very little charring is evident here as we begin the excision. We have removed the proximal area and made an incision. Now we're going to remove the labial section of the frenum. I'm using 0.9 watts continuous wave so that we have a minimum of charring and a minimum of postoperative pain. We have removed the proximal area and made an incision. Now we're going to remove the labial section of the frenum. I'm using 0.9 watts continuous wave so that we have a minimum of charring and a minimum of postoperative pain. It's interesting to note that as the laser energy is absorbed by the tissue, the photothermal effect actually causes the tissue to just melt away. Very, very little charring, if any. Now we're going to remove that section and then examine the amount of frenum that is still remaining. You can see that we're well into the connective tissue, and we're just going to deepen this very slightly. Begin again, please. Keep the lip under tension so that the tissue is properly excised. Morning, Bob. Thanks for coming back. Could you tell us a little bit about how you did after this little laser procedure we performed last week?
I've had absolutely no pain. From the time we've had that work done, I've eaten and had no problem, and it's healed very well.
Great, great. Now I would like to remind you to keep that area clean, and we'll check on it in another week or so to make sure that it's fully healed and that it hasn't grown back in any way. So have a great week, and we'll see you next week, okay?
Thank you.